Hi, welcome back. My name is Dr. Ivy Branin, and if you're joining for the first time, I'm a naturopathic doctor specializing in women's health and hormones, working with patients all over the states and all over the world virtually. I also see patients for different digestion problems and, of course, acne. And if you like this video, don't forget to like it. And of course, we're always putting out new and exciting content on women's health and hormones and other health related topics. So feel free, and I highly encourage you to subscribe to my YouTube channel so you don't miss any of the great coming up videos. Today, I want to talk about antidepressants, anxiolytics, and sleep medications. Specifically, I want to talk about tapering off them and why it might be a good idea to add a naturopathic doctor to your team if you're deciding to come off of any of these medications. So, why do people normally go off anxiolytics, antidepressants, and sleep medications? Well, first of all, it's definitely very much an individual's choice. But the biggest thing, at least I see the most in my practice, is side effects, specifically weight gain, decreased sexual desire, headaches, insomnia, nausea. So these are some of the reasons why a patient might choose to go off one of these medications. Another issue is that some antidepressants, specifically MAOIs, that's monoamine oxidase inhibitors, and tricyclic antidepressants are contraindicated during pregnancy. And also there's a couple of different antipsychotics also, though there are psychiatrists that are very much used to or familiar with working with fertility and during pregnancy, but it could still be a good idea for some patients who are wanting to get pregnant or find out that they're pregnant to come off some of these medications. The other reason, kind of, I guess, also why someone would even choose to come to a naturopath in general is this feeling of that the antidepressant, anxiolytic, anti-anxiety medication is just a band-aid, and that the patient is ready to go deeper and actually find the cause of their depression and anxiety or even their sleep issues. And then the other thing that some patients choosing to go off some of these medications and they feel they're ready is that they're ready to really feel and confront a full range of emotions. So some antidepressants, some patients will even say that they feel like dead inside or very flat, and they're ready to really experience the full range of emotions, because it's definitely not abnormal to feel low sometimes or anxious sometimes, and learning other methods to deal with those emotions. So those are just some of the reasons why some patients might choose to look at coming off some of the medications. Now, the problem is it's often a very difficult process. So why is it that tapering off antidepressants is so hard? Now, interestingly enough, it's not necessarily because there's a dramatic return to the mood disorder that put the patient on the medication in the first place. So it's not necessarily a return always to depression, anxiety, or insomnia, but rather withdrawal symptoms, which is collectively referred to as discontinuation syndrome. So what are some of the symptoms of discontinuation syndrome? Brain zaps. Specifically with I work a lot with patients who have been on Effexor, and it's one of the classic discontinuation syndrome symptoms. Dizziness, flu-like symptoms, insomnia, nausea, imbalance, sensory disturbances, abdominal pain, actually a lot of symptoms mimicking IBS. I see this specifically in patients coming off of benzodiazepines, and hyperarousal. And so hyperarousal actually very much coincides with insomnia. And just to give you an idea, about 1 in 5 will experience some of the symptoms of discontinuation syndrome during the tapering process. And this is particularly if, one, they're tapering off too quickly, which I see happen all the time, actually sometimes under a psychiatrist's guidance, or if the medication was for a long period of time. And reality check, when a lot of these antidepressants, SSRIs, selective serotonin reuptake inhibitors, were originally marketed, they were actually really only meant for about, I think it was about like 2 months, and now people are on them for many, many years. So the longer you're on the medication, that is also going to impact the symptoms that you experience during the tapering of antidepressants. So why would you want to work with a naturopath if you're tapering off antidepressants, anti-anxiety drugs, or sleep medications? The first is that naturopaths can guide you through a more gentle tapering schedule, which typically, if you were working with me, I would work side by side with your prescribing doctor, whether it's your psychiatrist or your PCP, your primary care doctor. And one specifically when I'm working with patients who are tapering off benzodiazepines, my preferred choice is the Ashton tapering method, which you can always, and preferably working with psychiatrists that is very knowledgeable of the Ashton method for tapering. While I'm tapering my patient off the medications, I'm recommending specific nutrient cofactors and amino acid precursors that support a healthy balance of the neurotransmitters that a lot of these medications were either mimicking or facilitating. So things like, some of the neurotransmitters would be dopamine, serotonin, norepinephrine, and epinephrine. And when you keep these more imbalanced, you're going to have less withdrawal symptoms. Also, working with a naturopath will help to support dietary and lifestyle choices that will help to bring more emotional and physical balance, which is really, really important, specifically during the tapering process. And then the other part, like if we think back, when I was like, why do people want to come off these medications? Specifically, a lot of these patients want to find out why am I so anxious? Why did I have depression in the first place? And a lot of it actually has to do not so much about neurotransmitters per se, but more dysregulation of other symptoms. So I'll often look at adrenal gland function, both underactive and hyperactive activity. And if you want to learn more specifically about adrenal fatigue, I have a whole video on adrenal fatigue. Thyroid function. I don't know what the statistics are, but a lot of cases of depression actually are very tightly linked to thyroid function, hypothyroidism, Hashimoto's disease, so very, very important. The reproductive system, the balance of estrogen and progesterone and testosterone, all are going to have a big impact in mood. And then even our digestion system, our gastrointestinal system. If we think about this idea of the second brain, meaning that actually the majority of our serotonin is actually produced in our digestive tract, plus also there is connections between our digestive tract and our brain, and they really do influence each other. I also have a video on that, all talking about stress and IBS, and there's some really great tidbits on how our digestion actually can affect our mood. So hopefully you found that helpful, and whether or not you choose to work with me in your tapering journey or another naturopathic doctor, there's definitely so many options out there, but the best option is working with someone who is trained rather than trying to figure it out yourself. Again, my name is Dr. Ivy Branin, and if you like this video, don't forget to like it and also subscribe to my YouTube channel. Definitely having some more exciting content coming your way, and hopefully I'll be seeing you next time. Have a wonderful day.